In this video, we're going to talk about how to tell whether you just need a tummy tuck or a 360 circumferential body lift where we go all the way around with the incision is going to be a better procedure for you. My name is Dr. Sinead Gallagher. I am a plastic and reconstructive surgeon in Miami, Florida. And if you find this video useful, please like and subscribe. Okay, so first of all, what can a tummy tuck do for you? So there are lots of different patients that can benefit from a tummy tuck. Some main reasons would be after a lot of weight loss where there's loose skin. Maybe with your anatomy, you just have loose skin. That's part of your anatomy. And liposuction alone isn't going to contour the abdomen the way you want it to. We need to get rid of that extra skin. And so that will be a tummy tuck. Or of course, anybody who has given birth, a lot of patients may have loose skin after that, really depending on your genetics. So with a tummy tuck, what can we achieve? So first of all, the most powerful thing about a tummy tuck is getting rid of loose skin. So unfortunately, there's not really many good ways to get rid of loose skin out there apart from making a cut or an incision. If there was a good way, we wouldn't be doing facelifts, we wouldn't be doing any sort of lifts really, or tummy tucks. We would just use that other technology. There are some technologies that give you a little bit of skin tightening, such as radiofrequency microneedling or Morpheus, but really to get an effective and transformative tightening of the skin, we're going to have to cut it out and that means an incision all across the bottom of the tummy. Now, in some folks, if there's just a little bit of loose skin, we can do what's called a mini tummy tuck, but the majority of patients will need an incision, which we usually put down low, and it is from hip to hip. So it's the first thing we're going to achieve with the tummy tuck is tightening up that skin. The next thing we can do with a tummy tuck is tighten up the abdominal muscles, and this especially applies to folks who've had children or carried children. Oftentimes they can have what's called a diastasis recti, where the six-pack muscles will separate. A way to tell whether this might be you or not is to lay down and lift your head and have a look, and if it bulges a lot more in the center, that this may mean that the six-pack muscles are separated. And when we do the tummy tuck, we can tighten up those muscles at the same time. And then of course the other thing that most surgeons like myself will do at the time of a tummy tuck is some liposuction as well, to better define the abs or get extra curves or get rid of curves, depending on what your preference may be. So all of that is for a tummy tuck, and that's really for folks who just have loose skin on the front of the trunk. Now, in some folks, especially who've lost a lot of weight, they may have loose back skin as well. And so not only will they have loose skin on the back, but oftentimes they'll have sagging of the buttocks as well at the same time, as well as sagging on the external thighs, not the inner thighs, the external lateral thighs, so the outside of the thighs. And so if that's the situation, it may be a good idea to extend the tummy tuck incision all the way around the back. So we go 360. Typically, we'll start the procedure with the back lift and then flip the patient while they're asleep to do the front. And so this is a little bit more of an extensive procedure, but in folks who have loose skin in those areas we mentioned, this can be an absolute game changer. So you're getting a full body lift and reversing the effects of the loose skin. Typically, it's for folks who've lost a lot of weight. And what do I mean by a lot of weight? Well, usually over 15% of their body weight. Or even massive weight loss folks or more than that. So, you know, everybody varies in what their needs will be and what their preferences are after surgery. Talk to your surgeon, but hopefully this video helps you decide what is the correct procedure for you.